Now, Trump wants to reveal information about his health. Dude, Epstein is here to stay. We do not care. Show us the Epstein files. You had your chance to show America your health records? Former President Donald Trump's recent medical checkup is raising eyebrows after new details were released about a common but chronic condition. So, what's going on with Trump's health? Let's break it down.
That many in the media have been speculating about bruising on the president's hand and also swelling in the president's legs. So in the effort of transparency, the president wanted me to share a note from his physician with all of you today. In recent weeks, President Trump noted mild swelling in his lower legs. In keeping with routine medical care and out of an abundance of caution, this concern was thoroughly evaluated by the White House medical unit. The president underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70. Importantly, there was no evidence of deep vein thrombosis or arterial disease. Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits. An echocardiogram was also performed and confirmed normal cardiac structure and function. No signs of heart failure, renal impairment, or systemic illness were identified. Additionally, recent photos of the president have shown minor bruising on the back of his hand. This is consistent with minor soft tissue irritation from frequent handshaking and the use of aspirin, which is taken as part of a standard cardiovascular prevention regimen. This is a well-known and benign side effect of aspirin therapy. And the president remains in excellent health, which I think all of you witness on a daily basis.
According to a statement from the White House, Trump underwent a health exam after noticing mild swelling in his lower legs.
The diagnosis?
Chronic venous insufficiency, a condition that affects blood flow in the veins, often seen in older adults. It happens when tiny valves in the veins weaken over time, making it harder for blood to return to the heart. Reporters also questioned visible bruising on the back of Trump's hand images that sparked online speculation. Press Secretary Caroline Leavitt explained it was likely due to frequent handshaking and the regular use of aspirin, which Trump takes to lower the risk of heart issues.
Been diagnosed with chronic venous insufficiency after he experienced some issues with leg swelling and noticeable hand bruising recently. Tonight, I'm joined in studio here by Dr. Hassan Al-Dalemi. He is the network director of vascular surgery at Honor Health. Thank you so much for joining us in studio.
Thank you very much for having me.
Okay, so I've never heard of this before. What is chronic venous insufficiency?
It's actually quite common. Somewhere between 10 to 30% of adults in the United States suffer from chronic venous insufficiency. It's when the veins in our legs are not as effective as they need to be at returning the blood back.
Okay, so how serious is this?
It isn't really. Like I said, it's very common. Most often it's benign and easily managed with conservative therapy. On occasion, some patients may need some minor office-based procedures.
Okay, so the White House mentioned that the president had some leg swelling, some hand bruising. I think we've seen pictures of that on social media going around where his hands look really dark on the top and then, his ankles swelling. So how typical are the symptoms that we're seeing from the president?
Sure. So I think the hand symptoms are different from the leg symptoms.
Okay.
So the hand symptoms they mentioned were bruising due to aspirin, and that's true. That's something we do see. The leg symptoms were diagnosed separately using a vascular ultrasound.
Okay. So, is this common for someone the president's age? He's 79 years old.
Yeah, absolutely. The incidence of venous insufficiency increases as somebody ages, and it's very common in folks above the age of 70.
Okay, so what's the worst that he could be experiencing?
Again, like I said, it is common, it is most often benign, and it exists on a spectrum. Okay. So the majority of patients will have some varicose veins, extra veins that we see, some amount of swelling. On rare occasions, if the disease progresses, patients can develop skin ulcers or wounds that are troublesome and difficult to manage.
Okay, so could this limit his ability in any way to perform, or?
I mean, it's hard for me to know where on the spectrum his condition is, but from whatever information we have, it seems like it's just leg swelling. So that means he's very early in the disease process.
Okay.
And therefore, I would be surprised if it would limit him in any way.
All right. Well, the president had a physical back in April, and according to his doctor, he was in perfect health. So should the public be concerned at all about this recent diagnosis?
Again, I'm not privy to all the details. In general, chronic venous insufficiency is not something that one would need to worry about.
Okay. Okay. Well, that sounds pretty good. I like that.
Thank you very much.
All right, Dr. Al-Dulami, thank you so much for joining us here in studio.
Levitt said Trump's team ran a full vascular assessment ultrasounds, and Allen found no signs of deep vein thrombosis, no arterial disease, no kidney issues, and no signs of heart failure. In other words, this is a manageable condition, not a life-threatening one. Dr. Sean Barbabella, Trump's physician, backed up the findings in an official letter. Meanwhile, vascular surgeon Dr. Anahita Duahu hasn't treated Trump, said most patients with this condition can reduce swelling through exercise, weight management, and compression socks. The White House says Trump isn't in any discomfort and is still in what they call excellent health. Vascular surgeon Dr. Anahita Duahu hasn't treated Trump, said most patients with this condition can reduce swelling through exercise, weight management, and compression socks. The White House says Trump isn't in any discomfort and is still in what they call excellent health.
Hey, listen, I know that you're very busy, you have voting, you have stuff to do. I just want to ask you about this other major breaking news story about the Caroline Levitt is announcing that the president has been diagnosed with chronic venous insufficiency. It's from these, you saw recent press photos, you can see his legs are swelling. In fact, they're pointing out the fact that he has mid to late stage symptoms of chronic venous insufficiency. I don't know if they're honest or not honest. Usually they're not candid about his health condition. Is it possibly a distraction? All of a sudden they want to respond to something that they usually don't respond to when people ask about the president's health.
Yeah, I mean, obviously, I haven't seen the full report. I've just been reading about it, just like all of you. So we don't know. I think that they generally have been very cagey about the president's health and not actually been or disclosed any real information. We know that in the past, all his physicals and all of his health have been perfect. He's been the specimen of good health. And so this is a new development. So we're going to follow it over the next couple of days. And I'm just hopeful that they're honest and they release all the information. And anytime a president's health is in question, that should be released to the public.
Well, let me just say, they're not used to usually talk about it. To me, look, I hope he's okay, of course, but it is also a distraction. They're trying to change the news cycle with anything they can get because they don't usually talk about it. I will say that you can't. Thank you, Congressman. I appreciate you joining us.
Sure thing. Thank you.
24 election heating up. Any news about his condition is bound to spark questions. What do you think? Is this a non-issue or a sign of something bigger? Drop your thoughts in the comments, like and subscribe for more political updates. See you next time.